Hi, and welcome back to BiteMed, a podcast dedicated to helping you keep up to date with the fast evolving world of health AI and learning what is directly relevant to you. I'm Harish, your host and director at the Artificial Intelligence and Medical Systems Society. Today's episode marks the first of a special multi part series where we will feature guests from the International AI in Medicine Education Working Group, diving into core topics such as the future outlook of health AI in education, standardizing frameworks, and many more topics all audiences will find useful and relevant right from the experts. Let's dive in. We're excited to have Dr. Laura Rosella from the University of Toronto and the International AI in Medicine Education Working Group, a consortium of experts dedicated to equipping a diverse global audience from clinicians and researchers to policymakers and students with knowledge required to apply AI in real-world contexts within healthcare. Welcome, Dr. Rosella.
Thank you so much for having me.
Could you tell us about yourself and about the organizations you work for?
Absolutely. So, I am a professor at the University of Toronto. I hold a Tier 1 Canada Research Chair in Population Health Transformation and Analytics, which means I research lots of different topic areas using health analytics, big data, big focus on predictive analytics. And about 8 years ago, started working at the intersection of AI and medicine, developing and validating AI tools intended for health system applications. I also am the education lead for the Temerty Center for AI Research and Education in Medicine at the University of Toronto, which I'll tell you a little bit about later, otherwise known as TCAIREM. And I also lead a training platform called AI for Public Health, where we're trying to build AI capacity across Canada.
That's great. Could you tell us a little about TCAREM? Because that's a really big organization, especially in that came up from the east side of Canada. We'd love to know more about that.
Yeah, absolutely. So TCAREM was made possible through a very generous donation just around COVID, just before COVID times, around 2000. And it was a center based out of the Temerty Faculty of Medicine at University of Toronto, dedicated to transforming health through AI. So at the point at which the center was created, there was this recognition that AI is really important. Obviously, health and healthcare being a major sector where AI could have a lot of benefits, but there wasn't really organized community around this. And there was research happening, but little bits and pieces everywhere. Toronto, obviously, where TCAREM is based, it has a hub for AI for decades. So this was an attempt to sort of bring that all together and really focus on the healthcare aspect, specifically the mission, advancing research, education, digital infrastructure, and creating this really engaged community. TCAREM has three main focus areas. So we're led by Dr. Mohammed Momdami, who's an internationally recognized leader in AI and healthcare. And then we have research, education, and infrastructure. And so I focus specifically on the education stream, where we're trying to make sure that all the different types of people in healthcare, including learners, but as well as clinicians working in the systems, health systems administrators, and those that actually have to use AI in practice, as well as those developing those cutting edge applications and thinking about the ethical and legal aspects of it, all come together and think about building capacity. And we also work really closely with our medical school to think about how we're evolving medical school curriculum for this new AI era.
It sounds like a lot has been done in terms of at least research overall, like worldwide, and also at TCAREM. But one aspect of what you were just talking about, it seems like there's still a lot to be done in education. At least it's been some of our experience as well overall. And I guess sort of to jump into the working group and the consortium a little bit, can you tell us a little bit about some of those educational work that you've done at TCAREM and how that has translated into essentially the founding of the International AI Medicine Education Working Group as well?
Yeah, absolutely. So we launched a number of TCAREM educational initiatives. One of the first things we did, and this is still ongoing, and one of our most popular programs is the summer student program. where we funded mostly undergraduate medical students, but also undergraduate students from other areas like computer science and engineering and other health sciences to do a summer program where they're actually working on an AI and medicine project. And we have some wraparound programming for these trainees. And the first year we did this, we had projects from all over the place. We were overwhelmed how many projects there were available, as well as the demand. So it was very clear that students were really looking for places to hone these skills. Now, 5 years later, the program is hugely successful. And at the end of the summer, when we see these trainees presenting their projects, honestly, it's like the cutting edge of AI in healthcare. They're not doing simple projects and just getting a little bit of learning. They're really advancing. They're deploying AI tools. They're developing new modalities. They're refining the legal and ethical frameworks. Like they're really at the cutting edge. So that was sort of our first focus. The other focus, I'll say initially, was just to get some conversations going. We had rounds. We had rounds from our trainees. We had international speakers come in, talk to the community about what AI is, kind of demystifying. We had amazing, great sessions there. And then we sort of evolved to more specific educational offerings, still wanting a lot of demand. So the one thing when I started, I said, there is so much out there, but it's freely available and it's all over the place. It's not really organized. So instead of us trying to create all of our new education initiatives, can we at least organize what's there for our audience, which are people working in the health system that want to learn more about AI and what it means. And it can be all the way from deep technical coding resources to applied pieces. So we created something called a resources hub. It's on our website as sort of everything that's freely accessible out there, and you want to do some self-learning, let's help you out. Then I would say the last bucket where we really got into what led to the International Medical Education Working Group is we started focusing on supporting the undergraduate medical education, working with the curriculum leaders there at U of T to sort of shape what actually AI education should look like in medical school. And there was already things happening, and I'm very happy to say the students drove a lot of this. There were a lot of student-led initiatives, student-led working groups around AI and medicine, sort of saying, we need to learn this. We know what's coming. We see it in all aspects of our lives. So there was a lot of push from there, which was very good. And then we sort of expanded the 1 hour lecture into more detailed self-learning tools, detailed case studies with TCAIREM members who were actually deploying and developing AI in health systems, and really worked to advance that. And then we organized residency training. So we'd go to academic half days and we'd put on sort of different types of workshops on critically appraising AI in the literature, basics, some applied aspects. And so that was our foray into really some of the more formal educational offerings. TCAIREM's not an academic division. We don't do programs. We more support with the existing programs. And what I'll say through all that is we really realized that, and through all that, we were talking to other schools and we were talking to all other centers around AI and medicine. And we realized there wasn't a lot of consistency. Some schools were taking, a very technical approach to this and really honing in on those computer science skills and the foundational theory behind AI. And some schools were doing a little bit of applied work. Not many were focusing on critical appraisal. It was really all over the place. But what was very clear is that every year, certainly I would say TCAIREM was a leader. We had great leadership and we were organized and pushed. But every year that we went on, we started seeing more and more of our colleagues around the world say, we're trying to figure this out too. We also got a lot of reach out from schools across Canada, as well as schools around the world saying, we don't have anything like this. We need to advance AI in medicine in our context. Can you help us figure that out? And so we started realizing there was this global community that's really dedicated, that wants to do this well. And how can we leverage all of those efforts happening around the world?
That's amazing. And I guess to before we jump in to talk a little bit more about the working group, Something that I'm a little bit interested as well is one of the things we've always seen is with a lot of these courses and offerings that are out there, they either are very much specifically focused on one group of the audience, let's say to specific medical residents in a specific specialty, or medical students, like first year medical students in Canada, or just healthcare administrators. Having said that, there's not a lot of that around yet in terms of like AI education. But and then there's also obviously like computing science students and people who have AI experience that want to know more about AI in healthcare. How do you reconcile sort of all of these together, having offerings that would be able to sort of satisfy everyone from that whole spectrum of people who know little about AI but a lot about medicine, to people who know a lot about AI and little about medicine?
Yeah, this is a fantastic question, and I think that this question really gets at how we're organized and where we need to evolve to. So, when we first started TCAIREM education, we drew this little Venn diagram that says there's sort of three audiences that we think are coming to us. So, there's clinicians who need to know something about AI because they're going to intersect with it in their clinical practice. Either they are intersecting with it now or they will, future clinicians. Then there's the developers. So these are people that actually need deep knowledge. They are looking for a peer group where they can bounce their ideas off because they're innovating in this space and they need peers to be able to innovate with. And then there's this group of people that are thinking about the responsible deployment of AI in healthcare. It's obviously a lot of risks, a lot of benefits, a lot of complexity to navigate, and it's all new territory. And we sort of said, what we should not do is try and build one set of educational offerings for that would fit all of these, because then what you do is you end up boiling it down to kind of like nothing, which does happen in a lot of places. It's kind of designed for no one. So what we try to do is actually think about those audiences all the time and think about what educational offerings would be useful for them, and then try and tailor it. There is a need for fundamentals always. I think it's important. We can't, and we need people that have deep understanding of fundamentals. But I think the most important thing is that we're being comprehensive across all the aspects of what we need in AI education and medicine, which means fundamentals, thinking about how we integrate with clinical practice and quality of evidence, how to be responsible, how to do deployment and monitoring in a healthcare setting, how to do change management, and how to integrate digital technology into healthcare. So we have to cover the whole thing, and that's what's important. And different phenotypes of learners will engage with depth to those different pieces according to their needs. And so we really want to make it clear, like the spectrum of what AI in medicine really needs, in terms of educational offerings to be ready for what's coming. And you know, I think there's a temptation to focus on just one, and that's okay. But I think you have to be explicit about, well, you're just focusing on these pieces and just really understanding all the other aspects. One more point I want to make that's makes this even more challenging is the people coming into medicine now are very different. So we're kind of dealing with a shift of learners coming in with a lot of experience, coming in with computer science and coming in with engineering backgrounds. So they're not coming in with sort of a health science only background, and not really, they're coming in computationally savvy. And so what do we do with those individuals as well? So there's a bit of a clash happening right now across medicine, and we have to just be aware of it. It's not a good thing. It's not a bad thing. I mean, I actually think it's a good thing, but we have to be aware of it. And if we start designing for any one individual, we'll sort of miss people out. So, yeah.
I'd like to say it's a good thing, but I'm biased. I came from engineering to
There
medicine,
you
so
go. I was like, it's you.
I'm one of those.
Yeah. Yeah.
I'm glad you brought that up. Like that's actually very interesting, and like I think that the differences in backgrounds actually makes up for that diversity. But of course, it makes it a little bit challenging with like some of those courses. Like it's been our experience as well in terms of even electives and stuff for medical students. How do you come up with something even for like an audience that you think is homogeneous enough as medical students, you still have some of those challenges of how do we make sure that this is good for everyone that's trying to take this course or that's trying to take this module. So
Yeah, and really we have to make hard choices. So what do clinicians need to know to be able to practice in an AI enabled health system? And then what things are people going to go off and learn on their own, right? And this happens all the time with clinicians. Like you will have clinicians that will go do deep training in neuroscience and genetics and all kinds of aspects of science and become experts there, and that's okay too. But what are the fundamentals that we want to make sure everyone knows?
Yeah, it seems like the needs of new learners in the field of AI and also healthcare and the entire field, it seems to be always changing, right? Like it's again exactly what you mentioned. Now, people that are coming into medicine, they have a variety of different skill sets from the past, like different 3 or 4 years ago. It's very different, right? So, how are you keeping up with that in terms of like the resources that you're providing? Because you're trying to find that balance again, like you mentioned, right, between standardizing the sort of information that's out there for learners versus keeping up to date with the latest trends. So how are you? What are
Exactly.
the challenges you're facing?
Yeah, and this is where our sort of traditional curriculum processes need to evolve. So this is quite different, right? Like than most of the things we teach. We teach lots of we recognize that we need to teach X. And we integrate it, we plan for it, and it might change a little bit, but for the most part, and we go through these very sort of formal processes to update curriculum. Now, with AI and digital technology, it's not the case, right? So I actually teach these in these areas as well myself, and it's not like I can just set my curriculum and then roll it over year to year. Every year, I have to update it. Every month, pretty much, I have to update it. So this is where I think our global network is really helpful because anyone we should not just rely on one instructor teaching it and say, well, I hope you're updating it. We can really rely and learn from each other on this. The other thing is we have to teach that to our students. So we have to say, this is what we're teaching you today. But actually, if you're going to work in the space of AI and medicine, and you will, and you're going to encounter it, here's how you keep up to date. So we actually have to teach people on how to keep up to date. And we have to teach people to say we're introducing some important concepts, but just know that all of this is going to change. So what's going to be your plan for keeping up to date? And start integrating some of that in there, which is a big change from most of the way we teach and most of the things we teach. But I certainly say that to my students when I'm teaching these is, what's your plan for staying up to date on this technology? Like, let's write it out. Let's show how you're going to stay up to date. And then I really believe, and this is what TCAIREM does quite a bit in our curriculum offerings, is staying close to the people that are innovating on the cutting edge. So they're always bringing that in with the students. So I happen to work in the space of AI and healthcare, so I see some of that up close, but maybe others are not seeing it on a day-to-day basis. And so can we bring people in that are right at the cutting edge? And then the other thing I'll say is, yes, things change. So that was the idea also behind our resource hub. We made it kind of evolving, and I'll talk about this with the glossary, this concept of a living glossary, because we know things are changing. Some things don't change though, and we have to remember that. Like a lot of the tech changes, but the aspect of how do you integrate, you know, AI into clinical decision making or algorithms into clinical decision making. There's some fundamentals there that don't change, even though the actual algorithm will change. There's some fundamentals that don't change in the deployment and oversight space. sure, we can have all kinds of, now we have this large language model, and before we had that model. But the principles of monitoring performance, doing real time evaluation, prospective deployment, those things don't change either. So there's enough that we can. It's not that we're completely revamping that from year to year, but this is a space that's constantly evolving and changing. And the other thing I'll say is not new for medicine, right? Medicine has a lot of technology enabled, especially in the surgical areas, that have dramatically changed, even in 20 years. Take the field of ophthalmology, for example. So, you know, there's lots of things we know about how to stay up to date. And robotic surgery, for example, another example. And we can borrow from those concepts and evolving our curriculum.
Okay, yeah, you mentioned the living glossary, so standardizing those definitions and what is really important about that, and what is this living glossary? Could you give us into the details about this?
Yeah, absolutely. So maybe before I do that, I'll talk about the International AI in Medicine Education Working Group, because it was from that group where this glossary emerged. So this working group is a consortium of representatives from universities and healthcare centers around the world that are dedicated to advancing AI education in medicine. So, and I'm sure you'll provide the link to the listeners. You can think about it as a group that sort of came together to say, I see you're working on education. I'm working on education. What can we do together? And came the Alliances of Centers of AI in Medicine was very heavily involved in bringing us together. So we came together and said, okay, we're all struggling with the same thing. How do we integrate medical education into AI education into medical curriculum, as one very specific example? How do we training residents? How do we enable all of these disciplines in the computational and the health sciences to work together? And so we kind of came up with a list of all the things that collectively we were wanting to share and come together on. And just to give you a sense of who's in this group, we have individuals from across North America, like Cleveland Clinic and UC San Diego, Stanford, and also in Europe we have people from Cambridge, from Italy. So we have all these individuals working in their mostly medical schools or hospital-based sort of affiliated university centers. And coming together around this. And so when we came up with the ideas, one of our members, Oris Boyko, said, there was this glossary that we kind of created, a very simple one, because we were finding that there was a language barrier. And overcoming the language barrier really opened up the ability to actually enable a lot of education initiatives, because you end up spending a lot of time, if you see curriculum in this space that was developed, a lot of the first bit is, what does this mean? What's a performance metric? What's machine learning? You spend a lot of time there. And so they sort of raised, this is something that all those different centers were saying, this is something that actually was useful for us. So we decided, we could take this on and actually imagine what would happen if we brought our collective wisdom around this glossary, and we made it a living glossary. And it's to the point that you raised earlier, which was, we can't say, okay, these are all the terms you need to know to do AI in medicine, and away you go, and this is what they mean. Instead, we had to say, these definitions are evolving. I bet once we put this out, people are going to make suggestions and make it better, which they have. And so we thought that this was like a practical starting point for those conversations, and really enabled a lot of education. We also thought we need a global framework for curriculum, because we were all focused. So in our first year together, that's what we did. We focused on creating this living glossary, and we focused on creating the global framework.
So I guess I'll actually jump in to talk a little bit about the glossary. I do remember, like, when we were having these discussions about the glossary and how we were trying to make this sort of like into a living document rather than something that just stays there for like eons and people just keep using the same terms. And I like your point previously as well of some things don't really change. It's those concepts and stuff are still there, but there are just some of those new terms or new concepts that emerge, and then we just keep adding those. How do you think something like a living glossary could fit into like the current clinicians and healthcare professionals, I guess, for the lack of a better word, pockets? Like, how can they use something like this in like more of a clinical setting? And the reason I'm thinking about this is there are these other tools that we have, like bugs and drugs, I think it was called, for like infectious disease stuff that people check and no one really thinks about it anymore. Or like we have anticoag that people check for like coagulation stuff when something like that happens, and they're like, oh, we have a patient that has this specific characteristics. Can we use what sort of anticoagulation can we use for this? So how do you think something like the Living Glossary, in terms of like medical AI, could fit into some of those tools that are already out there, and how could this be, I guess, advocated for in clinical settings to make sure that people actually make use of tools like this that are very helpful, but for them to just even know that it exists as well.
Yeah, and I think a couple thoughts on that. So first, again, we wanted to reduce the initial barriers. So the language barriers around, you're a clinician, you come up, you're open Epic or whatever EMR, and then you get some kind of thing about some algorithm that does this and has this performance and is meant to do this, and right away it's a barrier, right? Because you don't really understand what it's saying. You're intimidated, you think it's something you don't understand, and so these are the things that we're really trying to make sure that we have a shared understanding. So in real time, like, this is something, if you come across a new agentic AI solution that's doing some care coordination for your patient, you're right away can say, well, what's agentic, what does that mean, how do I explain this? And so right away just kind of breaks that away. Of course, you may want to learn more, which is where the curricular comes in, and you need to learn more. But right away, it takes away that sort of language and make sure that that inconsistent language, that we just get on the same page. The other really interesting thing, I know when I started working, coming from a more statistics background, and I started working in the AI field, we have different terms for the same concept, right? And there's actually quite a few terms that overlap. And then I started saying, oh, and I kind of had like my Rosetta Stone built in my head saying they just mean this. They just mean sensitivity. They just mean positive predictive value. And then all of a sudden I was so much more comfortable, and I felt like I could engage in the results. So that's sort of what we're hoping to do. So with this, and when we say living, it's being updated and improved, and people are already submitting terms. We're in the process of turning it into something that's interactive, that could be on your mobile device, for example. Really important, it's openly accessible, it's globally informed, and all examples are in the context of medicine. So yes, I can look up what gradient descent means, but the way we structured it is gradient descent is this is where you might see it in medicine, for example. And we give an example that's specific to the health setting. And then right away, we've sort of lowered that barrier and allow individuals who may or may not have a background to actually engage on the key concepts and terms. And it's contextualized to their setting. So that's kind of what we were going for. And again, it's been very useful. Like, everybody was reflecting on, as soon as they had something that clarified language, that right away was one of the most important things from an educational point of view that enabled that.
That's amazing. I really like this document, and I'm sure we'll put it in the notes later on so people can actually check this out as well. I don't know if there was anything else you wanted to mention about the glossary.
Yeah.
So I'll maybe let you do that, and then I have a question about the framework, because I think it relates a little bit with that validation piece that you were just talking about.
Absolutely. So, what I will say at the glossary, for our first kind of pass, we put it out as a static document. But what we're doing now, and there's a subcommittee of our working group, and amazing technical team around this is that we're making it much more interactive. We have like podcasts about the terms. We have different ways of interacting with the terms that we're developing. And then there's also mechanisms to suggest, better definitions, examples that we think will better resonate from a medical perspective. So that's what's happening now. So if you're kind of pay attention to version 2.0, which is going to be much more interactive. And again, if you're thinking about using this as supporting your education, like if you're an educator in the space, think about how you can use this and pieces of this. So we're making it sort of much more interactive and multimodal with the different ways that you can interact with it, which we're, again, very excited about. And we hope it's never static. I mean, it's static now is our first version, but we hope this is something we're going to keep adding terms. We're going to keep making the terms more usable. And I think that's really the best part about it.
Yeah, I'm also really glad you brought up that part about educators educating themselves as well, because that's been also another thing. If we start talking about this will be another 2 hours on the podcast, so I probably won't go there as much, but it's just some of the stuff that we've been chatting about in terms of like our education I guess portfolio that we've done here at Ames. It's been sort of on that aspect of a lot of educators telling us that they don't also know a lot of these things, and how do they actually teach the students if they don't have, I guess, enough background, and when does that background becomes enough, and how does that work? And I guess a little bit about the validation aspect that you were just talking about before. You brought in ophthalmology. I was actually talking to an ophthalmologist yesterday, and we were just chatting about like people using these AI scribe tools. And for example, one of the things he was mentioning was that one of the notes he got from one of the ER docs had this scribed by whatever AI algorithm at the end. And so he was like, I went back and read it, and it seemed like this was not really validated. It was just produced by an AI scribe. But maybe the physician didn't really look at it as much. I think this sort of brought up the whole thing about we need to validate some of these tools. We need to know how to validate as well. And maybe we need a framework for that. So I think the working group has been working on a framework for that as well. And I know we're sort of at time for this podcast, but maybe we'll give a bit of a hint about what that is about to the audience, and then they can hear more about it at the next episode.
Absolutely. I would love to preview the framework for medical education and AI, which is, now that we've sort of worked on terminology, which was the glossary. And again, anyone can interact with the glossary, like very low barrier, and we just want to get people engaged. Now we're actually talking about a structured curriculum or a roadmap to readiness. So you're talking about clinicians and that ophthalmologists being a critical user of AI in their setting. And that's what we want, right? We want not just people like intimidated by technology, but we actually want them questioning it and using it in a way that's going to improve patient outcomes, that's going to improve our health system. And we want clinicians to be building AI and being part of the future that actually creates the best tools for the system. So we started talking about curriculum. And again, this is where when you have a global group, it's just amazing. Everyone sort of came together and said, well, what are you guys doing? And what are you thinking about it? And we started off with, I think, like 4 or 5 buckets and ended up going into a 7-part curriculum, 24 learning objectives, very detailed. And again, a framework that says, okay, you can use this as your roadmap to design how we are building education in a comprehensive way. It has, principles, those learning objectives, and they can be adapted. They're not meant to say, it's not meant to be, okay, here's the framework, you use it exactly as such, but you can adapt it. So I think it would be great to come back and talk to you about those 7 dimensions and how they came about, which ones weren't there initially when we realized. You were just talking about, validating and what needs to be done when these tools are implemented. And that was a really important piece. And then there's some existing educational offerings out there. I think AIM's offerings are amazing, that do parts really well, but we want to see the in full spectrum. So like going through how those came about was very, very interesting. It wouldn't have happened if we didn't have a global group coming together thinking about it and bringing each of their unique perspectives.
Well, that's great. Definitely, we want to have another episode on about diving into the global framework, because a lot of our listeners are also educators, right? And educators, comp sci students, medical students, of course, right? And diving into a global framework is really important, because we need something that, like this, going back to our conversation about standardization, that's very important, right? So definitely we will jump into that in the next episode.
It's fantastic. And I love to hear there's a lot of educators listening. I just want to say that I think, people ask me why I'm so interested in education and, what is it about education that always draws you to all these initiatives? And for me, I'm also a researcher. I also work in health systems, and that work is very rewarding. But I feel that contributing to education is actually the long lasting change, right? And so it's really important to me that we're actually thinking about actually giving capacity, giving people the tools. That's how you get that real change in the system. And that goes above and beyond any, AI discovery I could make. So I just think it's an important part. It's so rewarding. It's so rewarding seeing young people come that will be influencing the field for decades and decades to come, long after I'm around. So I just think, and this is why education is a core pillar. So love to hear that.
Sweet. Thank you so much for your time today, Dr. Rosella. We learned so much about the International Working Group and TCAIREM. We'll definitely add those links to the hub on our website, and we'll also add it to our podcast info. And we'll see you next time for our next episode.
That sounds great. Thank you so much for having me.
Thank you.
Thank you.